Welcome back to our video on what you need to know about refreshing your eyes. I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. Let's continue and discuss our very unique one-stitch eyelid treatment. For the upper eyes, it is very common that we trim that extra eyelid skin, though this is different from a traditional eyelid treatment. Traditional eyelid treatments, they will consistently remove the skin, muscle, and fat around the eye, and that's not necessary. As we age, we already know we're going to lose volume around the eye, and we don't want to accelerate this volume loss and hollow the area out with a procedure. With my one-stitch technique, I preserve the muscle and fat. It's not necessary to remove them. I take only the skin. Now it's less invasive and requires less recovery. Patients love their natural-looking results. There's just one stitch. We trim the knot here, and I pull out that little thread. They look great, and patients appreciate avoiding a hollowed out appearance. You can also perform the one-stitch treatment for the lower eyes, and this works well when combined with facial fillers. Traditional lower eyelid surgery can also be performed to remove fat pockets, tighten or remove muscle, and remove extra skin, though there is a risk that the eyelid can droop. This is why we prefer to give volume back to our patients. The majority of our patients are very happy with their fillers, and as we discussed in the last video, preventing the need for a surgery, and if they still want to do surgery, they can, though most will avoid it. Lastly, for the eyes, I will briefly discuss laser. Laser resurfacing can tighten the skin and improve the appearance of the eyes if you have a more fair complexion. If you have a lot of pigment in your skin, you may not be a candidate for laser resurfacing. How do you know? We discussed previously the Fitzpatrick scale goes from 1 to 6. Based on the amount of pigment you have in your skin, I'm a 1, I burn very easily, and a 6 is African American skin. A Fitzpatrick 3 can burn, but they have enough pigment that they can tan, and a Fitzpatrick 4 burns rarely and can get olive complexion dark. We do not recommend laser resurfacing for Fitzpatrick 4 patients and higher because of their risk for hyperpigmentation or darkening of the skin. If you're a Fitzpatrick 3 or lower, you can benefit from the skin tightening and collagen building effects of the CO2 laser resurfacing around the eyes. IPL can also help with pigmentation for Fitzpatrick 1 through 4 and sometimes Fitzpatrick 5 skin types. Patients ask about wrinkles around their crow's feet and around the eyes. We can't take the wrinkles away 100%, and when we smile big, we will always have some wrinkles on the side, and those are our best looking wrinkles, by the way. Wrinkle relaxers like Botox, Dysport, Xeomin, Jeuveau, and Nutox, they're all helpful, and they do soften the appearance around the eyes. The goals are to soften the wrinkles and not eliminate expression. It's an artistic balance, and it's important that you find the right formula for you with a skilled provider. We definitely don't recommend getting the cheapest Botox per unit if you really want your best result. Okay, that is a wrap for the eyes. Thank you for watching these important videos. We have great options for replacing volume, removing redundant skin, light or deep laser treatments, and if you're a candidate, of course, wrinkle relaxers. Knowing these basics makes it much easier for you to make your best decisions and safest decisions and get the most natural looking results. I am Dr. Rich Castellano, double board certified facial plastic reconstructive surgeon. I've got my eyes on you, and I'm looking forward to seeing you in the next video.